So equine influenza, or the flu, it's an orthomyxovirus. It's transmitted by respiratory secretions. It has high morbidity, so everyone gets sick, but not a particularly high mortality. Very seldom is there death. Clinical signs: fever, anorexia, mucopurulent nasal discharge, and also you'll have lymphadenopathy or lymph swelling. So you do have to be a little careful and try to discern whether you're dealing with something like strangles or the flu. You can diagnose via testing. Treatment is supportive care. You basically just have to let it run its course. And there is also a vaccine for this, another intranasal vaccine that you can give. Plus also often you find an IM vaccine in combination with the herpes virus, which we'll talk about in a minute. They say the intranasal is even more effective than the IM, so if you definitely have a high risk, you may want to consider that, but it's a little bit more complicated to give. Horses hate intranasal vaccines. It is obviously a little bit more expensive. So depending on the amount you travel, horses coming out of your barn, you may want to consider the intranasal flu vaccine versus the one that's in combination with the herpes virus vaccine. So rhinopneumonitis, or EHV, this is what I was just talking about, can come in a vaccine with flu. Equine herpes virus has both types 1 and 4. Most commonly, the most common kind is a respiratory disease, respiratory secretions. It can also express itself in a neurologic form, which is reportable, and can also cause quarantining of facilities. You may have heard of horse shows, barns, etc., all being put under a 30-day quarantine due to this disease. And the neurologic form can get severe enough that it does cause euthanasias, death, etc. You also can have EHV1 can cause abortion storms in mares. The neurologic form: ataxia, fever, loss of anal tone, paralysis, and recumbency. Diagnosis is post-mortem PCR. There is also a respiratory panel Cornell does. It's a swab plus blood work that can test and try to determine between EHV, strangles, flu, etc. Treatment: isolate the respiratory cases and supportive care. Again, with things like this, it is highly contagious, so hygiene, quarantine, etc. Fomites, so usually people and things like muck buckets or pitchforks, etc., can be major culprits of transmission. Also, another thing to think about is horses can be carriers of this disease, and high stress situations can cause them to start shedding. So that's why we'll often see outbreaks at horse shows. The horse is fine, then they get to the show, they become stressed, especially if it's a long horse show. Some of these big horse shows can last for days or weeks, and the horse will then become sick and start shedding the disease, and then it gets spread around the entire horse show. And again, there is a vaccine for it. COPD, chronic obstructive pulmonary disease. The slang term is heaves or broken wind. This is usually caused by some kind of allergen, dust, or mold. You'll see the horse will have difficulty breathing, especially on exhalation. You may even see what we call a heaves line. You'll start noticing that after all the effort it takes for them to push, they'll get this line across their abdomen. If you listen, you will hear wheezes, especially on expiration. There'll also be coughing, nasal discharge. It may be white, it may be green, and lack of stamina. Treatment, depending on the cause. It used to be something that was a big problem in the winter. Horses would come in, be in dusty, poor air circulating barns. So the cure was to get them outside as much as possible. There are some kinds of COPD that are also caused by summer allergens, so pasture-related COPD. So you do have to know what your allergen is. Watering down the hay if you think the problem's in the feed. Steroids can also help to reduce the inflammation. Antihistamines, so if you're having allergy issues, you can give them antihistamines and steroids, sometimes in combination. You can now do things like allergy testing, and they do make these vaccines. There's a little bit of question of how well it works, but it is an option. Chronic COPD can lead to permanent damage, so in the lungs, which can always cause breathing problems going forward. Exercise-induced pulmonary hemorrhage, so pretty much bleeding from small pulmonary vessels. It's caused by strenuous racehorse exercise. Racehorses especially, also barrel racers, things like that, horses that need to run fast, breathe hard. So high blood pressure through small vessels. The clinical sign is epistaxis during exercise, though it has to be pretty severe for you actually to see a nosebleed. Sometimes you'll just notice they're just not breathing as well, or they just don't seem to be moving as fast. And you can do endoscopy. They even have endoscopes you attach to bridles so that you can race the horse. It can be amazing how much blood can be in the lungs and the trachea after exercise that actually isn't coming out of their nose. So doing these mobile diagnostics is really important. Treatment, rest. They'll give Lasix. The theory is that by thinning out, reducing pressure through smaller vessels. So Lasix is a big thing you'll hear about. Some tracks don't allow it anymore. It's not even allowed in Europe at all, but a lot of people will do Lasix injections before horses run. Nitric oxide, bronchodilators, and anti-inflammatories. Laryngeal hemiplegia, this is the same thing that, for example, older labs get. We call it roaring because when the horse gallops with this, they'll make this roaring sound. It's paralysis of the muscles of the arytenoid cartilages. Very often, this is what pulls the vocal folds out of the way during inspiration. These muscles are innervated by the recurrent laryngeal nerve, which travels down the neck on the left side, goes around the aortic arch, and then back up again. So somehow trauma to this nerve causes this paralysis. It's most common on the left side, but it can be both sides. It can be mild, it can be severe. Again, usually you need to do some kind of endoscopy. A lot of places, for example, places with treadmills such as Cornell will put the endoscope on the horse while they're trotting. You can do endoscopy while the horse is running on a track, etc. You can do surgery such as a tie-back surgery, which can leave it open, does suggest risks about things such as aspiration, etc. But a lot of these horses, if the surgery can be successful, and they can go on to have good careers. So, skin disease or integument, dermatophylosis, dermatophytosis, cutaneous papillomas, melanomas, sarcoids, and squamous cell. So dermatophylosis is rain rot. Any of you who have been grooming, especially Haley lately, may have noticed some of this. It's caused by Dermatophilus congolensis. It occurs in high temperatures and moist conditions. So this is summer, but really it can happen year-round, especially if rain, water, etc. Their backs get wet and they have those thick, fluffy winter coats. It's like that gets damp underneath and can also breed rain rot. Also in the summer, though, when it's very humid, they'll get anything from this mild dandruff to crusty scabs to these big matted tufts of hair. It's usually over their back or hind ends that can even come out, and it'll be in these painful chunks of pus. You do have to be careful because it is contagious, so if you curry a horse or groom a horse, you want to clean your brushes in between. The treatment is to scrub and remove the crust, so especially if you can bathe the horse, bathe them with something such as chlorhexidine or betadine scrub, let it sit and remove the crust, and then you can apply topical antimicrobials. Also, I've seen people use immune stimulants. In really severe cases, people have tried systemic antibiotics, but it's usually a hygiene issue. So here's what the matting can look like. And again, sometimes you can pull these off and they're like quarter or dime sized lesions that are pus, and it's very painful and gross looking. So dermatophytosis, trichophyton and microsporum. So this is your ringworm. Again, direct contact, clinical signs, same as cattle. It's these round, rough patches. Clinical signs and fungal culture can diagnose this, and you can do iodine scrub, sulfur dip, and ketoconazole or other antifungals. Both of these diseases, the sunlight helps. It helps to dry things up, clean things out. So whenever possible, I tell people, I've seen cases where people put blankets on, take the blankets off, get the horse in the sun whenever they can. Cutaneous papillomas. So Equus cabalis, papillomavirus type 1, direct contact. So these are warts, mostly on the muzzle, more common in younger horses than older, and they will spontaneously regress. Melanoma, so these are benign growths. They're most common in gray horses. You can see them in the tail, the anus, the head. Also, they can happen in the lymph area, like in the throat latch, and you can even get internal ones. Seldom are they malignant. They can become malignant. And I have had a few cases where horses have ended up getting euthanized due to internal melanomas that weren't necessarily malignant, but just became so large that they caused other issues. Treatment, surgery, usually especially the ones around the anus, don't cause problems with defecation, but they can start to become ulcerated. So you can try to debulk them with surgery, and people will try to put like beads, like cisplatin beads, things like that, into them to help reduce them. But it's pretty much impossible to get rid of them completely. Sarcoids, this is a pretty dramatic image to the right. Horses will usually have 1 to 2 smaller ones, but they're cutaneous tumors. There is a theory that it's due to the bovine papillomavirus. It can be a lump anywhere and kind of look like anything. They often have a bit of a scaly appearance. Treatment, these are variable. Often you can make them angry and they'll come back, they'll recur. Chemotherapy, irradiation. There are certain creams, even topical creams, one is called Xterra, that does seem to do a pretty good job. Some people have tried cryotherapies, things like that, but immunostimulants, things like that seem to also help. You just have to be careful because they can come back, or even if you remove it, they may still have kind of a patchy scar for the rest of their life. Excuse me. Neurologic diseases. Okay. So these are different, mostly in pretty much all infectious diseases, other than wobblers, or that can cause neurologic signs. So botulism, this is part of the Clostridium family, Clostridium botulinum, which we talked about a little bit in cows. It's the same bacteria, lives in the soil, and it's ingestion of infected feed. So again, we talked about round bales with dead animals in it, or that have gotten really nasty, moldy, rotten round bales or hay bales. Horses tend not to eat moldy, nasty feed unless they don't have an option. So especially in cases, if people are feeding nasty round bales, they're probably not keeping their horses in the best condition. Signs are ataxia, weakness, progressive paralysis, and respiratory paralysis. This is a lax kind of paralysis. Usually the first signs you'll notice tongue laxity. They can no longer chew and swallow. Treatment, antitoxin. You can inject it. Also, some equine clinics will keep a horse that they have given a lot of antitoxics so that they have super immune plasma, and you can do plasma transfusions. And supportive care, the main thing is they'll have difficulty swallowing, they'll be dysphagic, so you have to give them IV fluids and get them food either through a tube, etc., things like that, IV, to keep them supportive. And they can reverse and they can survive. They may not come back 100%, but it's a pretty intense disease to treat. There is a vaccine, but it's not used very commonly unless, as I said, you think your animal is in high-risk areas. Tetanus is the cousin, but instead of that lax paralysis, it's a stiff tetanic paralysis. So they get this kind of sawhorse stance that you'll notice the way the head is arched. That's very technical. Lockjaw. You can treat with antibiotics. You need tetanus antitoxins, the most important, as long as you're fast enough, and supportive care. There is a vaccine. It works very well. It's very cheap. FYI, horses and humans are the most prone to getting tetanus, and cats are the least prone to getting tetanus. So it's part of routine vaccination. And also, if I have a horse that is getting, for example, a castration surgery or has some kind of laceration, especially if I don't know where it came from, and has not had its tetanus within the past 6 months, I will booster the tetanus vaccine. Easy to prevent, very hard to treat. EPM, or equine protozoal myeloencephalitis. This is caused by Sarcoidosis neurona, or also Neospora. It's a protozoa. That is, the sporocysts from this protozoa are consumed in possum feces. So this is a big thing about possums. As amazing as they are at eating ticks, you don't want them pooping in your barn on your hay or in your grass, because they can then cause EPM. So this is a strange disease. It can be very vague and variable. Most commonly, I've seen asymmetrical muscle atrophy in the hind quarter. So the horse will be bright